going to look at the bone tumors along with the age group. So the first question we want to ask is, where is the simple bone cyst present? The simple bone cyst. So where is this? What age group is this present? Then looking at the second question, we want to ask, where is the osteosarcoma present? Where is the osteosarcoma present? So we'll be answering these questions and learning in detail. So to begin with, we are looking at first at the simple bone cyst. So simple bone cyst, it occurs at the age group of less than 20 years. Next, we look at the enchondroma. Enchondroma is present in the 4th and 5th decade of life. Then we move on to the osteochondroma. So this osteochondroma is nothing but seen in less than 18 years. Then comes the osteoid osteoma. Osteoid osteoma. This is seen in the 2nd and the 3rd decade of life. Then we move on to the osteoblastoma. Osteoblastoma. So in case of osteoblastoma, there is a posterior column of the vertebra. So the posterior column of the vertebra. And this is nothing but it is present in the 2nd and 3rd decade of life. This is the osteoblastoma. Then when we look at the osteoclastoma. Osteoclastoma is seen in the 2nd to 4th decade of life. So osteoclastoma is nothing but the GCT, giant cell tumor. And beyond this, there is an aneurysmal bone cyst. So in case of the aneurysmal bone cyst, this is present less than 18 years. Next, we move on to the osteosarcoma. So there is a speciality in case of the osteosarcoma. So the speciality of the osteosarcoma is that it is bimodal. So what do you mean by bimodal? It occurs at 2 different age ranges. So the primary is in the 2nd decade, and the secondary, if you see, it's in the 6th and the 7th decade. So these are the features. Then when we look at the Evans sarcoma. So what about the Evans sarcoma? It is present in the 5 to 25 years of age. Next, when we look at the chondrosarcoma. The chondrosarcoma is in the 3rd to 5th decade. And next we look at the clear cell chondrosarcoma. So the clear cell chondrosarcoma, it is present in the 3rd to 5th decade as well. So we saw the chondrosarcoma and then the clear cell chondrosarcoma. So both of them have 3 to 5 decade. Then we look at the adamantinoma. So the adamantinoma is present in the 20 to 40 years. Next we look at the fibrous dysplasia. The fibrous dysplasia. So the fibrous dysplasia is nothing but from the 1st to 3rd decade. 1st to the 3rd decade of life. And then we look at the chondroma. What about chondroma? It is present in a high elderly, that is the 5th to 7th decade. Next we move on to the MM stands for the multiple myeloma. It is the 5th to the 7th decade. Now we'll just proceed on to answering our questions. So the first question we asked was in case of the simple bone cyst. Simple bone cyst. What is the age group? So in terms of the simple bone cyst, the age group is nothing but less than 20 years. And the second question we asked was in terms of the osteosarcoma. So this is very important because osteosarcoma is bimodal. So it is bimodal peak. So what do you mean by bimodal? Bimodal means it has primary and the secondary. So primary, if you see, it is nothing but the second decade. Whereas secondary, if you see, it's nothing but the 6th to the 7th decade.